Hello. We're going to talk about Adlerian Therapy today. And I'm Russ Curtis, licensed clinical mental health counselor. If these are helpful, please like, share, and subscribe. I would love to fill up YouTube with ways to make people thrive or help people thrive. We can't make anybody do anything. We always want to remember stage of change. But with Adlerian Therapy, I credit Adler with a lot as kind of a basic building block from where other theories have gone. And of course, he broke from Freud, and Freud was with psychoanalytic theory, was thinking that everything's kind of instinctual and a lot of it's unconscious and all these drives. And Adlerian was saying, no, I think we're also driven by social needs and desires to fit in and to feel competent. And just know I teach theories and a half for the last 20 some odd years from 3 textbooks, Gerald Corey, Newkrieg's book, I don't know if I'm saying his name right, and Susan Day. You definitely want to check those out to get a really thorough understanding of Adlerian therapy and the other ones as well. Your professors may get mad, or colleagues, if I say this, but I think Adler, if you look at his theory clearly and carefully, was probably one of our first cognitive behavioral therapists, perhaps maybe one of our first positive psychotherapists, maybe group, and emphasizing kind of the social needs and desire to fit in, as well as probably maybe family therapy. He doesn't get credit for that, but just be aware that I think he contributed a lot and people built on his theory. I'm just going to cover, and what we're talking about here is just applicable essence. What are the ideas of this theory that we can apply in sessions with clients? So that's what all these videos are about that I'm doing, is how do we actually apply these and work with people? The lifestyle assessment, and there's various forms of that that you can find online and in textbooks, but I would argue that that's maybe our first intake. It's really finding out in detail and being curious about clients and who they are in relation to their culture, their family, siblings and parents and guardians and so forth. So it's a real thorough understanding. And I think you see this with intakes, that are oftentimes 10 pages long, and Medicaid requires a lot of information, but it really is important to be curious and to maintain that curiosity about your clients. Please remember that clients are complex and issues are complex. This is why no one theory works for everybody. It's always going to be, a complex intersection of theories based on what's needed at what time with the right person. So just never forget that. And a lifestyle assessment, or we could say intake, is a first step in understanding people's strengths or cultural heritage. Of course, we're going to get their issues, their education, legal history, medical history, and so forth. But I do think that he contributed a lot with this lifestyle assessment. Birth order is, first of all, there's research out there about birth order, but frankly, what I have found in working with folks, I do think birth order is important, but you can't just define it. I like to ask people, okay, so you're the firstborn in the family. How do you think that's affected your outlook on life and your relationships that you've had in the past and now, and how you view relationships? So I think birth order is important, but it's only to the extent that the client finds it meaningful, and let them make meaning of it. That can be a helpful therapeutic technique to also help them identify patterns and why they think the way they do. The question, we are going to see this again in solution-focused therapy. And so I think it was borrowed. The one that Steve DeShazer and Insoo Kim Berg with solution-focused talked about, the miracle question. I think it came from this question, which is a nice way to help readjust a little bit of a cognitive restructuring here, is that you're asking a client, if this problem were to disappear overnight, what would you be doing differently? The word doing is very important, because some people will ask, and I see this as, what would be different? And they talk about what other people would be doing differently, how they'd be treating them differently, how their relationships would be better. And that's when I like to pull out the magic wand and say, well, If we had a magic wand and I could change that person to think and do the things we want, that would be great. But since I can't, let's look at what you can do differently. Now, that can include how they can think differently, what they can do to become more resilient and to cope with the failures and the heartaches and issues that we all face in life throughout life. But just matter of fact, try it, because it's so often when I'm listening to tapes and supervision, somebody asks what would be different. The person starts talking about other people, and then it just stops. There's no response for that. It's like, okay, well, I'm going to see if we can make your mom nicer or make your partner more responsive. I mean, there's just nothing you can do. You always want to keep internal locus of control and what can the client do differently. And small steps are a nice thing to keep in mind. What are small steps you could do between now and our next session that might make a little bit of a difference? Early memories. I do find this effective, and I consider this one of the first cognitive behavioral strategies. I'm not as concerned with what people tell me, but what I like when people start talking about their issues is to ask them, where do you think you learned that? It stops people immediately. Instead of this being, oh, this must be some trait, this must be some genetic flaw of mine that I overgeneralize and I think the worst and I'm negative. It causes people to stop. Where did I learn this? And start to look back in the past. So with early memories, we can ask people, and it's really fun to do in the classroom, is I'll ask people to think of 7 to 10 of their earliest memories. And it does not matter whether they know it's real or not, okay? So they could say, well, I don't know if this actually happened. I don't care about that. Is this what they've created in their earliest memories? And then once they get 7 to 10, then let's ask them to say, hey, do you see any themes or patterns in these early memories? Oftentimes you will. And then ask them, how have these themes and patterns affected you in your life and relationships, in your career, in school, and so forth? So I do think this is a really effective cognitive behavioral strategy and a nice way to identify patterns related to relationships and so forth. Okay, so just a very brief summary of Adlerian therapy and all the contributions that Alfred Adler made. Please, again, like, share, comment if this was helpful, and let me know what you'd like to see more of. And we will see you on the next video. Take care.